This Grammetry case was completed by Dr. Sully Sullivan, one of our first KOLs working with Grammetry. The patient photos are not the same patient. We just put these in here as examples of photos that we want to see for Grammetry, which is full face, full smile, and then we want an exaggerated smile, just so we don't have any surprises with transition lines. The image on the right is the preoperative record. Now, this case is going to use teeth as the breadcrumbs, as they say, or the constant. Okay, these teeth are not going to be extracted, and we're going to idealize the anterior position of these teeth. This will be a free-handed case, right? No surgery, no surgical guide. So let's go through the process. So first thing that happens before surgery is take out your iOS scanner, scan the upper, scan the lower, and scan the bite registration, because this is too supported, so no TADs, no surgical TADs needed. Let's jump forward. Implants are in, and now the OptiSplints are screwed down to each multi-unit abutment, okay, and they're organized or rotated so that they're touching or just about touching. Not a requirement, but it certainly helps. And then doctor will simply add some composite down here in the holes in these areas. This is called the vertical arm and the horizontal arm, the part that stacks up. So they put them down here in the horizontal arm and fill these holes with some composite or with some stellar material, right? A very low to zero shrinkage resin. Fill them up like so, and then you'll bring in the honeycomb frame that is luted to all of the cylinders. This is the beauty of Grammetry, is that we allow you the ability to lute them all together in the mouth, as opposed to other techniques that we think are not quite as accurate. Lute them together, and then once they're all together, hit them with a light if you have a light cure material. And this is what you have, a solid frame, just like a traditional fit verification jig, very easy to make. And now you have the best of both worlds. You have something that you can scan, right? And you have something that you can remove. And if you want to, make a model, put copings in your restoration, send it to the lab for a final zirconia. There are some wonderful advantages to not being 100% digital. Now, Grammetry is 100% digital for the day of surgery, for the printed prosthesis, and then for the final restoration, we have some other very simple techniques to go to final, mostly digital, and someday it'll be fully digital. So take out your iOS scanner, one of the approved iOS scanners, and scan the full arch, including the teeth. Those are the references. Scan the scan body. This is the scan body part. Scan the frame, scan the luting material, and just capture the full arch. Please be sure that you have one of the approved scanners. These 5 work very well. Maybe you have a little bit of issue with the iTero with tissue. Turn off the AI, but the rest of them will work just fine in just about any condition. Once it's scanned, then to simply remove the OptiSplint jig, save it, okay, and then upload your files. And in this case, you'll have the pre-op upper lower, you'll have the full arch scan that you captured. Send those off to us at ROE Dental Lab. On our site, there is a Grammetry product that asks you just a few questions, and you drag and drop your simple STL files into our site, and we will assemble your files like so, and we will make you a prosthesis, and we will send this to you for you to print. All right? Very, very simple steps, very economical steps. And that is Grammetry.